Okay, good evening, everyone. Welcome to International Forum for Promoting Homeopathy. Today is our 915th day of English session. For last 949 days, continuously we are conducting this session without any break. That is a miracle. Now we are only 50 days to reach 1000 days. No any other organization has done this kind of work, this miraculous work in this world. I believe that. Anyway, we'll start the meeting with a silent prayer. Good evening and welcome once again. Thank you for the participation, and I'm appreciating all of the participants for your participation and enthusiasm to join in our webinar series. Actually, your participation inspires us. And today's our guest is Dr. Naga Nivetha. She has MD in Practice of Medicine and MD in Psychiatry from the National Research Institute of Mental Health, Kottayam. And she is working for since 7 years. She is practicing, and she has done clinical study in analysis and effectiveness of homeopathic medicine, reducing serum immunoglobulin E levels in chronic allergic rhinitis. And she published articles in GERD, gastrointestinal reflux diseases, in Ayush Journal. Today's topic is evidence-based management of chronic case with homeopathic medicine. I think she has joined, our guest has joined.
Shall I start, sir?
Yes, sir.
Okay. So good evening, doctors. So myself, Dr.Naga Nivetha. So I'm going to present a case. So with evidence. So evidence, today my topic is evidence-based management of chronic cases with homeopathic medicines. Ma'am, is my voice and my presentation is clear?
Yes, please proceed.
Okay. So I'm going to present a case which is having a regular follow-up more than 1 year. So a case, 18 years old female residing at Patanamthitta, Kerala, who is preparing for her UG NEET exams, belongs to high socio-economic status. So consulted National Homeopathic Research Institute in Mental Health, Medicine OPD on April 2021, presented with complaints of sneezing with coryza since 15 years. Actually, this case has been taken when I was doing my PG dissertation at Research Institute Kottayam. So already I had get an ethical clearance from that patient. That's why I'm just presenting this. So the presenting complaint of that patient is sneezing with coryza since 15 years, which had a gradual onset, and the sneezing had an aggravation on morning on waking, on taking cold drinks, on exposure to AC cold air, and during winter and rainy seasons, and on dust exposure. So even though these are the common symptoms, the symptoms with increase in intensity will be considered as a peculiar symptom. That's why the intensity has been added there, and had an amelioration with steam inhalation. So history of presenting illness. So patient was apparently healthy up to 4 years of age. So until her 4 years, he was normal. But after that, the complaint initially started as an urticaria. So after an housemaid infection, it's a bite. So after that, she has consulted general medicine physician and took antihistamines. And after that, she started developing sneezing, itching in eyes, ears, nostrils. So again, she consulted ENT physician and advised to take some skin prick test, an allergen challenge test, and finally she diagnosed to have type 1 hypersensitivity. So sneezing, which is very continuous in nature. So if we start sneezing, she will sneeze up to 10 to 12 times per episode. It will be continuing up to the whole day. It will be like that. So she is having severe itching in the eyes. She's a 3+ intensities, watering in the eyes, coryza. For that she needs 3 full towel, followed by nose block, post nasal dripping, heaviness of the head, difficulty in breathing, heaviness of the chest. So the single episode of sneezing follows this whole course every time. So she is free from disease only 10 days. So for the whole month, she will be having these episodes nearly for more than 20 days. So then regarding past history, so history of recurrent infections. So recurrent cold, tendency to catch cold easily. So since her childhood, she has taken conventional treatment, had a timely relief. And history of bilateral periodontitis since 2 years. She has a periodical recurrence of this periodontitis since 2 years and taken conventional treatment, had a timely relief. Her treatment history, she has taken antihistamines on and off since 13 years. She is taking inhalers regularly since 3 years. Then regarding her family history, so her father is having allergic rhinitis, her mother is having urticaria, elder sister is having PCOS. So regarding personal history, she is dwelling in tropical area. She takes mixed diet. She desires more chicken, and there is no particular addictions. Her menstrual history, she attained menarche at 10 years of age, and the cycle seems to be regular. Flow is normal, no abnormality in that. Regarding life space investigation, she is born and brought up at Patanamthitta. She is a second child to her parents. So all her developmental milestones are normal to her age. She received whatever she loved in her life. So her childhood seems to be satisfactory. Her schooling was good. She completed her schooling with 80% of marks. So main hobbies for her is drawing and painting. She did more drawings and painting and she get more prizes for that also. She is very reserved nature and she is very hardworking. Regarding physical generals, so her appetite is good and she tolerates appetite well. Thirst moderate, desire cold water, desires chicken, salads, spices, ice creams, aversion to milk, intolerance to cold things, stool regular, urine regular, perspiration is reduced, sleep sound sleep, position lying on the back. She is a chilly patient. Regarding her mental generals, she is very artistic in nature, very ardent, reserved, dependent, anger at least trifles, very sensitive, and she is very stubborn, obstinate. So regarding her general physical examination, so everything seems to be normal. So not pallor, not ectric, not sinus, no clubbing, no lymphadenopathy, no pedal edema. Her pulse seems to be 84 beats per minute. Her respiration is normal, 16 respirations per minute. Her BP is normal, 110/90 millimeter of mercury. Another systemic examination, especially examination of respiratory system, everything seems to be normal. She's having normal vesicular breathing in all over the lung fields. And her CVS cardiac system is also normal. S1, S2 here normally in all four auscultatory areas. And there is no focal neurological deficit. So she has done the investigations, serum Ig level and absolute eosinophil count level. So her serum Ig level is 1522.7 international units per ml and absolute eosinophil count is 623 cells per cubic millimeter. So normally the serum Ig should be less than 150. So her level has been raised and her absolute count is normally it should be within 40 to 4400 cells per cubic millimeter. It is also raised. So this patient came to our OPD with complaints of sneezing and coryza. So while taking the complete history, so she is a known diagnosed case of hypersensitivity, type 1 hypersensitivity. So along with that, allergy cells, everything seems to be more. So she is a diagnosed case of allergic rhinitis, and we had done peak expiratory flow also. Her values are in a red zone. So after complete case taking, so after analysis and evaluation, so the totality we have created, I have added a totality that is artistic, reserved, dependent, ardent, desire chicken, spices, ice cream, aversion milk, intolerance to cold things, hay fever, tendency to catch cold easily, periodicity, glandular affections, family history of allergy. So this is her totality. So while taking the case, while first time when has taken the case without detail, just with the she with this hay fever, and she is having, she craves for cold things, ice creams and the spices. And while first time she is very silent in nature, very dependent. So at first I thought of pulsatilla, but after I taken a complete history, and after that I just repertorized. So at that time I got the rubric, I got the medicines like this: Nux vomica, pulsatilla, arsal, phosphorus, sulfur, china, lycopodium, in this manner. So with that, with mainly with her mental generals, like after taking the case, I have noticed main thing, she is very sensitive. At the same time, she gets anger very easily, and she is very hardworking in nature, very artistic. So with that, and this, she is extremely chilly patient. The patient explained is that the patient can't able to open the doors and windows. She can't able to get the air, and she didn't sleep without fan, without this fan. She can't able to sleep with fan, especially with fan, AC. She can't tolerate. So her parents told that very sadly that we can't able to sleep with her, because she always her room is always warm. She needs everything warm. Even in the hot climate also, she can't able to put the fan. So that much actually, if she on the fan or if she get the air, she will develop the symptoms, especially her sneezing will start, or chest tightness, dyspnea will start. And from since 3 years, and since from her childhood, she can't able to take any ice creams or cold drinks or any cold fruits, water fruits, can't able, she can't able to take. So these are things. So with all these things, so I started I just prescribed Nux vomica. So this is her first report, like before starting her treatment. Her IG is 1522 and her AEC 623. So first with that, I just given Nux vomica 204 dose, weekly 2 dose, and BT applying grains BT3 TDS. And then I asked her that try to slow down, taper the allopathic medications. So after 2 weeks she came. So during her first follow up, only she had an 10% relief. So at that time it was April, so it was little bit summer at that time. So that time she had a 10% relief, but she stopped the histamines, antihistamine she has stopped, but inhalers she used to continue at that time. The symptoms: nose block has been reduced, sneezing has been reduced, but has chest discomfort, which has been reduced in morning, but night she is having the same discomfort. That's why she has taken inhaler. So this is the first follow up I get from that patient. So what I think is that the Nux vomica has been acted in that patient, because she is getting relief and she can able to stop the medications, and there some of the symptoms has been reduced. So what I did is I just increased the dosage. And at that time it was May, so so some rain was there at that time. So because of that maintaining cost and that climate, I thought, okay, we let me repeat. So I repeated Nux vomica 210 doses. So once in third night I asked her to put. So she continued this for 1 month, and then second follow up. So while coming for the second follow up, she told, so every time when she came for the come for the follow up, so if the sneezing is there, first time her face is fully flushed, her eyes are very swollen. So we can see the exact allergic signs. We can see the allergic shinners, allergic salivary, everything, allergic freeze, every allergic signs has been represented in her face. But when she came for the second time, that intensity has been reduced. And when she came for the next one follow up, it is May month, so that changes we had seen physically. So at that time she told she had a relief, 20% relief. An inhaler dose has been reduced. So every time, every day she used to take 2 times per day, but she told that now that this whole month she has reduced the inhaler dose. So alternative days she has taken, but there she has taken during night time. And when there was a heavy rain, she has a aggravation of the symptoms. Same just as discomfort has been present at that time. So at that time, I didn't increase the potency because I advised her to take the IG reports once in 3 months. So what I felt is that, so let me continue the same potency, but if the after seeing the IG level, I can able to rise or to reduce that. That will be decided depends upon the IG values. So I continued the same potency, Naxwamika 200 only, but the dose has been increased as alternative days. I advise her to take alternative nights. So because at that time, June month has been started, so rainy season, cold. So normally to avoid this aggravation, advise her to take like that. And then third follow-up she came during June month. So at that time, we had seen a marked improvement in her face and in her attitude also. So she told she had a very good improvement. So 60% she had a good relief. First time she told that she is putting fan during the night time because since from her childhood she is not able to put the fan, but she told that I can able to put the fan during night time and I can able to open the windows. She told that I just breathe the fresh air. It feel very nice. So I didn't experience this since my childhood. If I experience this, immediately I'll get the sneezing episode. Completely I'll be shut down. But now I can able to get that ear. Then sneezing has been reduced. Sneezing episode has been completely reduced. When there is any sneezing also, it does not end up to the chest discomfort. So what we have discussed that earlier. So it is not like that. Then chest discomfort present occasionally only at night time only. So this is her symptomatic improvement. But while I see for the IG values, it has been increased actually. So earlier it was 1500, but now it is like 1693.20 international units per ml, and our absolute count is also increased. It is 1025 cells per cubic millimeter. So at that time, patient told that even though the values has been increased, but I'm getting a good relief. So at that time, what I think is that maybe it's a time to increase the potency. So I just raise the potency to 1 m. So now patient is advised to do take Naxwamika 1 m 8 doses. Because the dose has been reduced because she had a good relief. So that's why dose has been reduced. It is Naxwamika 1 m 8 doses, weekly 2 dose. So this is our second report by taken on June. The values has been raised, little bit raised from the earlier. Absolute eosinophil count also raised. So after that, July month, so she came. At that time, she told that she doesn't have any complaints. That is, the inhalers, she stopped her inhalers completely, and she can able to sleep with windows open and under fan. So here she told one thing. Every time in her handbag or in anywhere she goes, she always with present with her inhalers only, like inhalers or either with the medicines. But now since 1 month, she told I was completely free with this inhalers. So I am not at all using the inhalers. So she felt very happy, and everything in generals also everything is normal, and his symptoms is everything reduced. But to reduce the serum IG level, the medicine has been repeated. So again here I prescribe Naxwamika 1 m 4 doses, so weekly 1 dose. So the dose has been reduced. Anyway, the medicine still is continuing to reduce the serum IG levels. So next on fifth follow, so at that time, it was like August. She used to have, since 2 years, every August, she used to get the perotiditis. So at that time, she explained us that she every month, this June, this July, August, September, with that month, she used to get perotiditis. So for that, miasmatic prescription has been given. So considering this case, the miasm is tubercular miasm, because there is a history of allergy is there and strong family history of allergy. and mainly glandular affections are there. So tubercular miasm, and she's a chilly patient and recurrent tendency to catch cold easily. So with that, we had given tuberculinum 1. So at this time, so main thing is we thought of sorinum as well as tuberculinum here, because both are good medicines for this hay fever, this cold tendency, everything. But with that glandular affections and with that strong tubercular miasm, we had selected tuberculinum 1. So 2 doses has been given, once in 15th day we are advised to take. So at that year 2021, she didn't get the episodes of parotiditis. So after that, September month, she has taken the IG values. So the main thing is that at the time she doesn't have any symptoms. She stopped the allopathic medications completely. At that time, she has taken first dose of Covishield vaccination. So she didn't have the episodes of parotiditis also. So again, the IG is increased. The reason is that immediately she has taken this report after this vaccination. So why I'm telling this, because of this vaccination means, so I have tested for 70 to 75 patients with serum IG level. So my dissertation. So that's why the patient who has taken the blood samples immediately within 1 month or 1.5 months of this COVID vaccinations or any COVID infections or any viral infections. So they are at, their values are seems to be raised, even though they are asymptomatic. So IG has been increased to 2000 to 2334.20 international units per ml. Her AAC count is 500. So that has been reduced. So 500 cells per cubic millimeter. But she's symptomatic. She's completely asymptomatic, and the tendency also has been reduced. So considering with this, so we think okay, it is the case is going in a path of cure only. So we have prescribed Naxvomica 1 2 dose. So only to reduce this IG level. So Naxvomica 1 2 dose once in 2 weeks, 15 days 1 night. We have as advised here. So this is her report. Second report. So third report, 2334, and absolute eosinophil count. So on next month follow up. So she didn't have any symptoms. Actually, the reason why I'm presenting this is the patient has gone through the whole year. So each and every seasonal variation. Everyone knows that this allergic rhinitis, this asthma, all these things has a seasonal variation. So when there is a cold, dampness every time, there may be the aggravation of symptoms. So that's why I just presented, because this patient has gone through all the seasons. So now it is in September month, October month follow up. So at that time, some cold, rainy, everything is there. But during all these times, she didn't have any symptoms. She just told that it is a very surprising for her, because every rainy season and every winter season she will be having a very massive attack. So every day her face is completely swollen, her eyes are swollen. She always with a handkerchief every time she used to have these things. But since 6 to 7 months, she is not having, she is not at all using all these things, and face is also normal. So she is telling very happily that she can able to put some makeups in her face. She can put the eyeliners, eye everything, because earlier, because of the watering in the eyes, itching in the eyes, she can't able to use all these things. So this is a very another happy mental satisfaction for that patient. She feels very happy that she can able to do everything. Dressing also, dressing sense. So every time when it was winter, she always used to cover one certain type of dresses only. But now she can able to wear every dresses. She can able to travel freely, and she has taken ice creams also. Earlier we advised her to stop the cold things, aggravating things, but without our knowledge, she just took and she told her that I have taken ice creams, cold drinks, everything, but I have tolerated well. I had 1 or 2 episodes of only sneezing only, that has been reduced by itself. So on eighth follow, still she had no symptoms. So again we prescribed Naxvomica 1 So now the dose has been much reduced. So only to reduce the serum IG levels, we had given this Naxvomica 1 So only 1 dose per month has been given. So then a ninth month of follow, the IG level has been much reduced. So in third time, we have seen that it is more than 2000. So now it has become 1213 international units. So IG has been much reduced and the AEC level also reduced. So this is the fourth report, 1213. Since January, its 10th follow-up is on January. So at that time also, she didn't have any symptoms. So now the IG level has been started reducing. So I thought, let me wait and watch. So that's why has been prescribed Saclac 4 doses weekly once. So on 11th month follow-up, she told that there is no more symptoms, but we had given Naxvomica 1 mg, 2 doses as an emergency dose. If she develop any symptoms, she is advised to put, but that she kept the 2 doses with her only. She didn't use that. She told that there is no need of use these things because she didn't develop any symptoms. She had occasionally 1 or 2 episodes of sneezing, but that has been ended by itself. There is no, it does not progress to the chest tightness or anything. She didn't have the chest, her chest is normal. So every month I used to do her peak expiratory flow meter test. So at that time the values has been increased. So for the 6 months she used to have in the red zone only, that is less than 200 only. But now after 6 months she can able her peak expiratory values has been increased. So she has improved to yellow zone. She doesn't touch the green zone, but her values has been increased. Her lung capacity has been increased. She can able to breathe well. On 11th month follow-up, so again no symptoms. So she is taking everything. So what are all the aggravating things for her? She can able to take everything. So she is taking cold things, ice creams, everything. So on 12th month of follow-up, so there is no episodes, and she had 2 episodes of sneezing on dust exposure. So that too everything. So while she was cleaning her room, she had dust exposure, and she told that this is the first time in her history she was cleaning her room, because every time her mother or another one, her maid only has to clean their room, because if any dust anything, it immediately she'll start developing the symptoms. So she just cleaned her room. So at that time too, she had 2 episodes of sneezing. So then it has been subsided it's by itself. So again we prescribed Saclac only. So since 3 months she was in Saclac only. She doesn't take Naxvomica she doesn't take any medicines. So again her IG has been much reduced. So it has been become 1008.7 international units per ml. Her absolute eosinophil count is 460 cells per cubic millimeter. So this is her report, 1008. So again, still the patient is on regular follow-up only. So after this 1 year, so with this whole case, the main thing I am showing that is, so we can see the evidence base. So with our homeopathic medicines, how the symptom has been reduced, and how her tendency has been reduced, and how the IG values has been reduced. So it is not like completely gradually reducing. So it has been increasing and decreasing. So there are the changes. This IG has been so much fluctuating in accordance with any infections. But even though the symptoms has been completely subsided, still the values are there. So that's why we just make and continue follow up. So this year, so after March, she is advised to take IG reports once in 6 months. So November she has done the IG test. So I didn't have the report, but because she reported in the phone, so at that time her IG become 540 and her AEC become 220, and still now she is completely free of symptoms. And 2022 also she didn't have any episodes of perotitis. Because at that again we had given a July month, again we have given the prophylactic tuberculinum 1 m 2 dose, same earlier as I was done in on 2021, same has been followed on 2022 also. So at that time I have given the hair tuberculinum 1 m. So this 2022 also didn't have any episodes of this perotitis. So still the patient is on regular follow-up. So we'll be seeing how the IG has been reduced, even though there is no symptoms. However, medicines used to, so still she is on regular follow-up only with Saclac. We'll be giving Naxvomica 1 once in 2 months. So to see that reduction in IgE levels. And the other findings, while I noticed regarding this allergic patients, the best remedies what I have noticed is Natramur had a very good effect on this allergic rhinitis. So especially when the patient is having, because while in allergic rhinitis, the patient is having the same common symptoms will be there: sneezing, coryza, postnasal dripping, and this itching, everything. But Natramur works in the patient, especially if the crawling sensation is more. So if the patient is having more itching, more crawling sensation on eyes and nostrils, at that time Natramul will work more. And Pulsatilla. So Pulsatilla is the second most best medicine I have noted. So especially Pulsatilla works for the patient with sneezing and coryza more, and with the patient will go for the rhinosinusitis symptoms. So that time Pulsatilla will work more, especially with the postnasal dripping. In that condition, pulse had been worked well. And sulfur. So sulfur is one of the best medicine I have noticed. So especially all the allergic rhinitis patient after their follow-up, so regular follow-up, after the complete subside of symptoms, the psoric symptoms is started manifesting. All the patient at the end, they will be start developing the crawling sensation or any skin symptoms. So at that time, so sulfur has been acted as a best intercurrent in many cases, and Naxvomica has acted well in many patients. So these are the best medicines. So because when in case of allergic rhinitis, so instead of going to any specifics, so we have many specifics like Sabadilla, Allium, Sipa, Arundo, Vaitya, so many medicines are there. Instead of simply going through like this, so we can take the history and if we prescribe it, it will be very good. Because while we are doing like this, we can see the complete absence, that the recurrence has been very much reduced. So if we prescribe the local acting medicines or like therapeutic medicines, it will subside at that time. It will not extend to the recurrence, it will not reduce the recurrence. But if we go through this constitution medicines, it will reduce the recurrences also. And at the same time, for every cases, investigations is must. For example, we had I had done more than 1 year my cases. So within 4 to 5 months, the symptoms will be subsiding, and with the 2 months, that will be fluctuating on exposure. It will be increasing, reducing like that. But after 6 months, there will be complete recurrence has been reduced. Everything has been reduced. So if I was doing IG values, so it is gradually reducing. So for that, if we do the evidence, if we do the repeated test, we will able to know that so how much level the IG values are reducing. So what is happening in case of IG? So whether it is fluctuating or not. So we can create the evidence, strong evidences. So we can show them like how our homeopathic medicines are acting. Not only it reduces the symptoms, but also it's evidence based. Laboratory also it is reducing. So that we can do. So for doing every cases, we should make an documentation and we should have a strong evidence. So thank you. So is there any doubts or any clarifications?
Time for discussion. Those who would like to participate can go to the participant list and raise your hand. And of course, it's a nice presentation. And one thing more important is that she did record all these things and presented well. That's the most important thing. And it indicates the need of the education. The more and more courses and education is needed for formally studying all these things. I think uh, in that situation, as advised by Honeyman, a small dose of sulfur and the resilient potency in between exomic is often advised. And you can see in the I'm not exactly remembering where it is, but you can see in the footnote of organ in the some aphorisms. Time for discussion. Yes, of course, the first person is Dr. Sridhar Group, sir. Yes, sir, please, you can unmute now. Yes.
Dr. Nivetha, it is wonderful. Of course, it takes little time, but it was completely good and in symptomatic as well as in evidence based. So I thank you very much. Your presentation was very nice. Please come such a type of to the presentation again. Thank you very much. Wish you all
Thank you,
the
sir.
nice.
Thank you, sir. Upcoming classes, if I get the chance, I'll present more cases with evidence based.
Definitely you will get the chances in this forum. IAPH will give you chance. Okay. Don't worry.
Okay, sir. Thank you, sir.
Wish you all the best. Have a nice.
Yes, of course, we are focusing more on young bloods. We want talented persons, and we are very much sure about that you are all persons who are really qualified and capable of doing that. Now, another person, Dr. Amir Malik, a researcher, scientist, come physician from Pakistan. Dr. Amir Malik, you can unmute now. Yes.
Honorable sir, namaskaram, greetings to all our honorable guests and doctors. Special thanks today our Dr. PB Naga Nivetha. If I'm taking any mistake, please let me know. Nivetha, it's right. Naga Nivetha. Honorable doctor, hi,
Excellent.
honorable doctor. Excellent lecture you have given. I am really very happy that you move the way to scientifically you have made the evidence. This is very important in homeopathy. That concept which more than 80-90% the people this layman have this understanding that the homeopathic doctors don't need the blood reports and etc like this. It's, I think it's totally wrong. We should when the patient come, we should advise the blood test, and when we start the treatment, and after the treatment we should continue this practice. So I'm really thankful to you. I am proud of you for your this kind vision. It's a very good vision. In the future you may continue with that way, because you have continuously concentrate on the immunoglobulin E and AEC test, the eosinophil count. It's very good. When the COVID-19, remember, it's the name of a mission, a court mission to destroy the world. They banned this test, the immunoglobulin test. That was banned in the countries. That test was not allowed, that you cannot check the infection levels. So what more proofs we need? But again, the way you have treated, I have found only one thing which I would like to share with you, that the time scenario is too long because it's upper respiratory tract. So in between the very first weeks and months, you can use the tuberculinum in the initial basis. The result will be very fast. I believe this, but we are the beginner. We are doing very well. I have a lot of praise for you. Very grand thanks to you. It's a very nice way of practicing. God bless you. God bless you, doctor. God bless you.
Thank you, sir. Thank you for your wonderful speech. Thank you, sir. So the
Thanks.
reason why I didn't give starting the tuberculum is that, so we started the medicine, sir. So let to see what will be happening with that IG values. So that's why I didn't change anything, and the sufferings also seems to be reducing. So that's why I didn't interfere, sir. After that, only I started miasmatic. So anyway, I will use this advice if the patient is having any cases I'll be having. So I'll start the miasmatic prescription as earlier.
Yes,
Thank you,
thank
sir.
you. God bless you. God bless you, honorable doctor. God bless you. Take care.
Okay. Now there is a question. What was the presentation of the patient when she came to you, Dr. Nivetha?
Sir, her presentation is acute presentation, sir. So like she
Yes.
came with, she told that she has been taking, it is not like she's having this complaint since her childhood. So she's taking, she's every time, so only 10 days in the month she will be normal. So she has become normal scenario for her. So she told that this is normal. So every time I'm going to the some physician, he'll be giving medicines, I'm taking inhalers. So it is my regular routine. She told that. So at that time, so I just have taken, and that's why the repetitions are more.
Okay. There's a question, another sac lag. Not is lacanine. Lacanine is a separate medicine. Sac lag is the sugar of milk. It's Arthur Edborough. Okay. Now, Dr. Hubert De Silva, please unmute.
Hello.
Yes, please proceed.
Can you hear me?
Yes.
Easter to you all. Wish you all. Doctor, Nivedita, it was a very,
Yes, sir.
very good presentation, and you are touched the core. I want to ask you, because you are taking the examination and studying the things, while you are as a researcher in psychiatry, psychology, what are the hopes and how we can say these are the things are happening in while how we can experimentally state that psychological management of with homeopathic medicine?
Hello, sir.
Yes, can you hear me?
Yes, sir. Sir,
Do
you're
you
asking in case
understand?
of psychiatry.
No, I'm asking you. You studied in made research in National Institute of Research Center,
Yes,
isn't it?
sir. Yes,
In,
yes, yes.
so I am asking you how we can say and how we can prove our medicines, our actions of homeopathic medicines in psychiatry and management of homeopathic management of
Sir,
psychological
yes, I
problems.
can understand your answer, sir. So
Yeah.
in case of, especially in case of psychiatry, we don't have much investigations, lab investigations. But in that cases, we used to have so many scales, so many validated scales are there. For example, in case of if we are treating schizophrenia, there are some named questionnaires are there, scales are, rating scales are there. So every time when they start taking these types of cases, they'll confirm the diagnosis of the psychiatrist, then followed by they'll start with the scales. So every time when the patient came, they used to assess with that validated scales. So we used to have the improvement scores, score value seems to be reducing. So in that way only they are assessing. So not with that lab reports, because there is no specific reports. For example, anything regarding neurotransmitters also, it is not validated. So it may be increase and decrease. So many bios will be there. So for psychiatry cases, mostly validated scales and questionnaires. In case of other things like regarding any substance abuse or alcohol, in that cases we used to have liver function test, regular liver function test. These things will be there. Other than psychiatry, other than these substance abuse, other things like anxiety disorders or obsessive compulsive disorders, we used to have a rating scales and questionnaires, sir.
Okay, I understood. But these are doing by the allopaths also. They are in psychiatry. They are doing the same thing.
Yes, yes, sir. Yes, yes.
But we want to learn the other things. I want to know whether you are checking the serotonin, dopamine, and all these type of hormones are major action on mind. So
No,
have you ever done such experiments in cases?
no, sir. Actually, we are not doing that things. The reason is that it is having like multi ones. If the in, for example, if you are seeing in OCD or any anxiety, if you are taking any neurotransmitters, it is not validated. It is not exactly. This is the confirmatory. If it is reducing, it means that improving. So it is not an confirmatory, and it is costly also, and the patient is suffering. So psychiatry patients are much suffering. So these things are not advised, sir. But nowadays they are trying to do the research, because to show that they are trying to plan, sir. So in with dopamine, with the neurotransmitters, or with MRI changes, anything they are trying to reveal, they are trying to do. But still it is in a question mark only. So it isn't, still we have to implement, sir.
Yeah. That is great. Thank you very much, Doctor.
Okay, there's
Thank you.
another question. Any findings on systemic examination like hypertrophied turbinates, DNS or polyp? It's another question.
Yes,
Nivedha.
sir. Yes, the patient had these things like turbinate, enlarged turbinates are there. All the compensatory mechanism, all these has been there.
Okay. Then another question is, what are the medicines for post-COVID developing allergies?
So post-COVID allergy. So mainly, what we have given mainly is that we had seen sulfur, sorinum, and naxvomica had worked well after this post-COVID symptoms.
Yes, okay. Thank you. If anybody would like to participate or you can add something, it's an important discussion, then So during these discussions, I think a couple of points to be remembered or to be meditated or rather reflected. One is regarding the diet and regimen. How you are following the diet and regimen is an important practice in containing these diseases. What is your opinion on that, Dr. Nivetha?
Yes, sir. In this, while treating these types of diseases, so initially we used to tell the patient the importance of diet and regimen. So what are all the maintaining cause we used to educate. So we advise the patient to be away from that cold things, aggravating things. So after that, when the patient start improving, we advise them to take gradually to see whether the patient is able to tolerate or not. So with that whole 1 year, more than 70 patients I have noticed with the homeopathic medications that can able to change their lifestyle. So the patients are able to take cold things. So many patients I have seen that they can able to eat ice creams, cold things, everything that has been much noticed, sir.
Yes. There the Hippocratic words, according to people and situations, is very much relevant. And in prescribing the diet and regimen, when the patient is naxomica, especially, he is very sensitive to all these things. So we must be more careful about that. Then again, according to medicines also, we must advise the diet and regimen. Then regarding the diseases, that some modification is needed. Then the environment changes, the weather, his occupation, all these things must be considered when you prescribe or suggesting some sort of diet regimen restrictions or modifications rather. Then another thing you should think about is the use of intercurrents. At what stage or whether it is needed. A lot of clues are given by Dr. Samuel Hahnemann, his Organ of Medicine. Reading between lines and a careful reading on the aphorisms is very much needed. In certain cases, he advises mercurius. In some other aspects, he advises Epperself, Naxomica, sulfur. A lot of medicines are there. That will always improve the conclusion of your case or the process. Then the potency selection, of course, another barrier. What are the potencies? And another important thing is the attenuation, how you prescribe the medicine. That's also important thing. The standard dose is dry upon tongue. Then another one is the most sensitive patient is inhalation. Then added water or the globules. So many methodologies are there. So that should also be kept in mind. Then another important thing is second prescription. What is second prescription? How to do second prescription? What are the things you needed? Again, another point is the observations. You just said so that the IgG is not reducing. At the same time, patient feels well. So these are the things, most perplexing or vexing questions for a classical homeopathy prescriber. Others is just about based upon certain therapeutic methodology. They will get cure definitely, but what is more substantial is the constitutional medicine. It's not an easy job, but that is the most important thing. So Ken's observation is very important. So that is the specialty of homeopathy. Especially we must reflect on this, the event of this Hahnemann, the World Homeopathic Day and birthday of Samuel Hahnemann. Yes, Dr. Nivetha, you have any comments on that?
Yes, sir. And another thing, one thing I want to tell, sir,
Yes,
so
please.
especially regarding dosages and repetitions.
Yeah.
So in these types of allergy cases, we used to give more repetitions. So especially if it is a private practice, in that case, we can give LM potencies, because the drawback of LM potency is a way of like this mainly how to take. So that is the main thing. That's why here I used only centesimal potencies. But while I was doing a private practice, I used to give LM potencies, because LM we can repeat it frequently, even though if it is not LM also in these types of cases, because the susceptibility is more, everything maintaining. So we have to repeat the doses, because earlier I used to take very minimum doses. So even though the medicine is correct, the cure has been taken very long time. So after that only had taken started repeating many times. So So not frequent, but the in needed according to that I have been repeated. So at that time I get a good results. So repetition and dosage is very important in allergy type of allergy cases.
Okay. Then regarding the storage of medicine, that is an important thing. The transportation medicine is another menace for the potency, the quality of potency. We can say like an article in the lesser writings. During the transportation of the vehicles, the potency may got some sort of alterations. That's also important thing. A lot of questions are there. There's from another Dr. Arthur. What is that? I think sac lag again, asking about sac lag. What is that?
No, I didn't give Nux vomica, sir. I just given the simply I didn't just rubrum has been given. That's why I've written a sac lag.
Okay. Dr. Arthur, do you want to speak? Yes, then you can unmute and ask something. Doctor, I think you are the first time in this platform. Dr. Arthur. Not responding. Maybe some technical problems are there. So that's a main disadvantage for this online platforms. Even though we are at a long distance, we are come together and practice or discussing for the last 950 days. There are some certain obstacles to this program. That is also happening there.
Can I ask something?
Yes, please welcome. Could you please give an introduction, self-introduction?
Thank you so much to be with you.
Yes, please proceed.
And I can ask, sac lac is lacaninium?
No. It is sugar of milk, doctor. Sugar of milk.
SH. You hear me?
SAC, sac lac, sugar of milk. SUGAR, sugar of milk. The powder we use to dispense the medicine as a vehicle. Got it?
Sir, actually, I didn't give the medicine. I just give the rubrum. That's why I've written a sac lag. So usually I just given that empty powder as well as sugar of milk. It is not lacaninium or any other medicines. It is not a medicine.
Clear? Dr. Arthur, are you clear? Is it clear?
Yes, I'm with you now. I have a good signal now.
Actually,
I can't hear you, but now I hear you very well.
Okay, it's clear now. Could you please give an introduction, self-introduction? Dr. Arthur, could you please introduce yourself?
My ask is, I can't understand. Sac lac is lacaninum?
No, never.
sir, may I explain? With apologize. May I?
Yes, Dr. Amir, please. Yeah.
The plaspu doses, the plaspu, the plain, the plaspu. Either it's not the milk made from the milk of sugar. Actually, Honorable Dr. Naga wants to say she then continuously gave the plaspu. This is the simple, which carries no medicine. I think what I understand. Yeah, it's not.
Yeah,
the
that's
medicine.
correct.
I'm right. Honorable Dr. Naga. I'm right.
Yes, sir. Yes, sir. This is just a rubrum. Just
Okay, so
a
please don't-
sugar of milk. Just a powder. I just given.
Actually, she wants to say she is giving last doses are only plaspu. It's not.
It's
Not
placebo.
the medicine either. If you
Yes,
say I
yes.
want to give from the milk of sugar, the medicine name is saccharinum.
Shakaram lactis.
Saccharinum. But
Thank
what
you
I have
so
to
much.
say, yeah. Don't worry, sir. Don't. I got your question.
Thank you.
God bless you.
For you too. Thank you.
Okay, now Dr. Sopana Ramavarma. Then 1 minute, please, madam. Proceed. Yeah.
Sac-lac is saccharum lactose. Saccharum lactose. Short
Exactly.
form of saccharum lactose. Sac-lac.
Okay. Yes.
It means the plaspu. The medicine is not given. This is
No,
our
it's
right
not.
homeopathy. It's a very good case. Honorable Dr. Naga, you have shared a very good case. Really appreciate it. In the future, please continue with the medical evidence. But unfortunately, in the end, the World Health Organization, WHO, said to us that this is a pseudoscience. It's a very shame of them when WHO use these words to us. And this is the only reason in the biggest pandemic, the
Yes.
critical.
Yes,
the
Dr. Amir Malik, you can solve these things tomorrow because tomorrow is our Hanuman's Day celebrations day 1. This
Yes,
welcome speech by Dr. Yahia, inauguration by Dr. Sahani, and speech by Dr. Amir Malik.
Thank you.
Of
Thank you
course.
very much, sir.
Then
It's
Dr.
really
Sridhar sir, we
grand
have
honor.
enough time, and I think now I invite Dr. Amir Malik to express a lot of thanks to Dr. Naga Nivetha. She is the first. She's made the debut in IFPH, I think. Yes, please.
Honorable Dr. Naga, really you have the way you have expressed is a very good scientific way. I really appreciate.
Thank you, sir.
The Honorable Dr. Naga, you have done a very good presentation. You may continue your presentation on our IFPH platform, the World Bus platform, the most seniors you found here. And we are working a lot, especially during the COVID days. And my request is to you is that, Honorable Doctor, may you please come and regularly join our sessions. It will be a great honor for us with this the same way as you have done today. It's really appreciated from the bottom of the heart. It's a very good way because the educated peoples need the evidence which you are giving, and continuously you are monitoring the IgE level and the eosinophil level. It's really appreciated to know these things is very important for the homeopathic doctors. So with a lot of prayers for you, Dr. Nagaji, you have done a great job. God bless you for this. And please continue to come our honorable platform with a lot of prayers. Wish you good luck and warm regards.
Okay.
Thank you, sir. Thanks a
Yes.
lot, sir. It's my
With-
pleasure. I'll continue, sir.
Yes. With that, let me conclude today's English session. Hope you to meet the same time tomorrow. Till then, goodbye. And it is all Dr. Hubert De Silva to continue the program in Malayalam. Thank you.